Is it that hard to wear a mask? It's not if you've lost a loved one to COVID-19 and understand the gravity of this pandemic. But for people with no connection to the coronavirus, it's easier to say that all these health precautions are over the top. And despite the science. Then there are surveys that show men are less likely to wear masks than women. Some claim it robs their manhood. Experts put it down to toxic masculinity. In the West, they said masks don't really protect you. Then they said they do and you've got to wear them. Whatever the case, if it means I'm less likely of passing on something, I'll do it. A lot of other men aren't so willing. There are lots of selfish people in this world. But what about when the masculinity in question here is that of the most powerful president in the world? DW's Mira Maria Fricker has this report.
On election day, the US is battling another surge in coronavirus cases. The number of new daily recorded cases has been reaching record highs. Some ICU units in the US are already approaching 90% of their capacity.
Well, things are very, very bad in the United States right now. We are having some of the largest outbreaks that we've had during the entire pandemic. And 9-10 months into this pandemic, we are still largely not quite prepared.
The US doesn't top the list when it comes to fatalities among those who tested positive for the disease. But it's much higher up when it comes to COVID deaths per 100,000 residents. So, can what went wrong be linked to the Trump administration's crisis management? Critics say the White House hasn't had a proper sense of emergency, especially at the beginning of the pandemic.
It's going to disappear. One day it's like a miracle, it will disappear.
And by referring to SARS-CoV-2 as the China virus, the US president may have been trying to shift responsibility away from his government. Damage control instead of disease control. And treatment ideas without any scientific evidence.
In a minute, supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light, and I think you said that hasn't been checked, but you're going to test it. And then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way. And I think you said you're going to test that too. Sounds interesting.
President Trump also ignored medical advice to wear face masks for a long time. Instead, he made fun of his Democratic rival, Joe Biden, who wears masks in public.
We will beat COVID, but you've got to be prepared to deal with future pandemic.
Biden is soft and weak and too scared to be president. He doesn't want to be president, let's face it.
But many Trump supporters admire the president's aggressive style and see him as a model of male dominance.
He is fearless, and this is why we're going to vote for him. That's why he's going to have another 4 more years, because he is not afraid of the naysayers and don't do this, don't do that.
Critics have pointed to Trump's response to the pandemic, like downplaying its dangers, as an example of stereotypical masculine behavior. But that may have come at a high price for the US, with his approach potentially contributing to more than 230,000 deaths in the country.
Yasmin Besan-Casino is a professor of sociology at Montclair State University. Why do you believe mask wearing's become such a gendered issue, especially in the US?
It's really interesting to see a virus become a political issue as well. In our research, we found that it's not just a gendered issue, it's also a partisan issue. For example, Democrats in the United States are more likely than Republicans to wear a mask. But it's also a deeply gendered issue. Women are more likely to wear masks. And it's not just about straight gender, but it's about gender identity. When we ask men how masculine they are, the ones who say that they're very masculine are the ones who really refuse to wear masks.
But can you tell me what it's got to do with masculinity? I mean, not washing your hands after going to the bathroom is just disgusting and irresponsible.
It is, but we also found that men are less likely to wear masks and also wash their hands. Mask became a symbol of traditional masculinity. It's about toughness. It's about being resistant to the virus. It's about health. And in the United States, especially, and most of the Western world, we do define traditional masculinity through good health and virility. So a virus can't really get you down, or even if you get the virus, it won't do anything to you. So our images of traditional masculinity really are very harmful here.
I guess it doesn't help either when the president compares manhood with invincibility.
Absolutely. And traditional masculinity and ideas of masculinity are at play there as well. So when we think about the American president, we had presidents who were cowboys and rode horses and cleared bush. So this is actually one of these ideas that go back to that. And this is also something that really harmed female candidates running for office. So it really doesn't help that the president is a part of this as well.
But if we just go back to the cowboys and the pioneers of the United States, taking protective measures is a survival strategy. Yet mask-averse men prefer to risk, death from a virus than expose their vulnerability?
Absolutely. Prior research actually shows us men are less likely to go to the doctor. They're less likely to seek preventive medicine. And even if they have symptoms, they're less likely to ask for help. So their definition of health is not really a very healthy one. So similarly, we do find that even if it's in their best interest and best interest of their families and children and communities, they're less likely to wear masks. Also, okay. We're a very individualistic society, and idea of wearing a mask is really going against that. I wear a mask to protect my community and other people. And in this case, traditional masculinity is a little bit more individualistic.
Exactly. All these men are invincible, but they're also irresponsible. I mean, does this have something to do with the fact that in many Western nations, the individual is more important than the community? You get very different opinions in China.
Absolutely. I think individualism is a big part of this. And I'm not just wearing the mask to protect myself. I am wearing to protect you and my community. And this really goes against this ethos of individualism that I can be alone. And this isn't a problem of our community that we solve together, but this is something I solve by myself.
OK, we've been talking a lot about men. What about the women who refuse to wear masks? I know a few of them.
A few of them are there, but most of them, research shows that a lot of them they tend to be more Republican than men. But also, we do see anti-intellectualism and mistrust of science. Among women, too, we do see that some of them are questioning science, and they don't really believe in the likelihood that they will get the virus.
Yasmin, what about you on a personal level? How does it annoy you when you walk down the street or I don't know, wherever you go and people aren't wearing masks or aren't sticking to the rules?
I don't go to many places these days, unfortunately. Unfortunately, I don't go to many places these days, but
Hashtag
it
stay at home.
doesn't annoy me that much. I do find it, I enjoy that at least it lets me go out, and it became the new normal for me and my family, and I like seeing people in my community wearing the mask, and we hope to beat the virus soon.
Yasmin Besancasina, thank you very much for joining us today, Professor of Sociology at Montclair State University. Pleasure talking to you.
Thank you so much. I appreciate it.
Now, if you've got any questions on the coronavirus, then feel free to write to us on our YouTube channel. DW Science correspondent Derek Williams will look into them.
What impact on national health will reopening schools have at this stage of the pandemic?
I've been sitting on this divisive question for a while to watch how things develop as kids in many countries in the Northern Hemisphere, including my own, returned to schools. If schools can act as super spreader sites and with classrooms being enclosed areas where lots of kids gather for extended periods of time, you'd have expected to see spikes in cases within societies as a whole in the few weeks after they reopened a couple of months ago. But a lot of current data indicates that didn't happen. Numbers of cases in both the US and Europe have, of course, risen dramatically since then, but many experts believe that isn't down to reopen schools, but to other factors. A number of studies from different countries, including ones that collect extensive contact tracing information, they're painting the picture that although kids can, of course, catch the virus, and of course they can give it to others, they don't seem to be driving community transmission, but instead mostly reflect it, especially younger children who appear to be less likely to infect others than older kids. But all in all, based on what we're seeing so far, clusters seem to develop pretty rarely in schools. That's at least one of the reasons why the German government, for example, has decided to leave them open, even as spiraling numbers of infections across the country have now sent it back into a November lockdown that's closed many businesses. How long schools will remain open here, though, is anyone's guess. As scientists never tire of telling us, we're in a dynamic situation.